counties in the state to report that one of our residents had tested positive for COVID-19. As of this morning, again, 20 days later, Yellowstone County has 32 residents tested positive, 208 Montanans have tested positive for COVID-19, 17 Montanans have been hospitalized, and 5 state residents have died. In an effort to slow the spread of this virus, last Thursday on March 26th, Governor Steve Bullock issued an executive directive providing for measures to stay at home and designating certain essential functions. His order of March 26th followed my amended health officer order of March 20th, closing certain establishments within the boundaries of Yellowstone County. Both my order and Governor Bullock's orders are in effect through April 10th, 2020. These orders are enforceable by the county attorney, and they have generated many, many questions and calls to our public health information line. Some of the questions and calls relate to compliance with child custody visitation orders, while others question if certain businesses should be considered essential. Still other callers report parties, people playing in the parks, basketball games, things like that. The governor's order prohibiting public and private gatherings of any number of people were put in place for a very good reason. We need to preserve increasingly scarce resources in healthcare by reducing the number of COVID-19 infections that we see. We're addressing you today from the county offices for a particular reason. My health officer order, as well as the governor's order, are legally enforceable. At this time, I'd like to turn the podium over to County Attorney Scott Twito.
Thank you, Mr. Felton. Thanks to everyone who came today. I want to first start with my comments by thanking most of the residents of this community. I think most folks are doing their best to be in compliance with their orders. They're trying to exercise the social distancing practices that we continually are reminded of anytime we turn on the TV or listen to any reports. This disease is now killing our Montanans. It's wrecking our economy. It's damaging this town that I grew up in, the state that I love. The law as written gives the governor and Mr. Felton, our health officer, the power to issue orders and the orders that they have issued. Likewise, their orders and the law says that I, as your county attorney, must enforce them, and I will. To do so, I work in conjunction with the Yellowstone County Sheriff's Office and the Billings Police Department. And I want to explain a little bit about this. Violations of this order are punishable by fines. In fact, if you violate Mr. Felton's order, you can be fined every day that you're in violation of an order. These penalties include up to 90 days in jail. I don't want to prosecute any of my fellow residents for any of these violations. I want you to do your best to be in compliance. I'm the last person that wants to have to put you in jail because you continually violate these orders. But I took an oath to follow the law, and I will. I'll do that to protect the community. Our health experts and the experts that consult with the governor have told us that these orders are necessary to protect us. The law requires that these orders are complied with, and the law requires that I enforce them. I'm asking you, as a member of your community and as your county attorney, do your best to comply with Mr. Felton's orders and the governor's orders. If you have any questions about them, please do not hesitate to use the phone numbers that are readily available. You can contact my office. I will do the best I can to communicate with you. But do not violate these orders. Take them very, very seriously. The law allows for penalties to be put in place. In fact, when these laws were passed, there was obviously some thinking by our legislators as to why we have these things in place. In fact, the law takes this so seriously, it gives Mr. Felton and the governor the power to essentially enlist law enforcement to help enforce their orders. And if law enforcement, and doesn't happen very often in the law, if law enforcement doesn't assist Mr. Felton, they can be charged with a violation of the law. That's how serious this is. I know that the folks that have enacted these orders, I know that the governor didn't want to do this. I know Mr. Felton doesn't want to do this, but they're doing this to protect you. I implore you, please follow these orders. With that being said, I would like to call up Lieutenant Brandon Woolley with the Billings Police Department. Thank you.
Good afternoon. Thank you. Like the county attorney said, my name is Brandon Woolley. I'm the administrative lieutenant for the Billings Police Department. I act as the public information officer and their designated infection control officer during this event. And I'll be speaking on behalf of Chief St. John today, who unfortunately won't be able to make it here. He's caring for a family member who recently had a medical procedure unrelated to COVID-19. Additionally, I'll be speaking on behalf of law enforcement in general about the orders that we're speaking about today. First of all, in law enforcement, we stand behind these orders on a couple of reasons. One, legally, because that's what we've been sworn to do, and that's what the statutes have outlined. But then two is fundamentally, we in law enforcement believe that this is necessary in the community. We're also community members as well as you are, and we want to do our part to do the greater good with this. So we're abiding by these orders to help enforce as necessary. First of all, before we get into kind of what this is going to look like, because I think there's lots of questions of what law enforcement involvement is, I want everybody to know that enforcement is not law enforcement's first preference for this. Our preference is for voluntary compliance, education if you have contact with law enforcement, and then after repeated or very egregious or blatant violations, then we will work closely with the county attorney's office and the public health department to issue citations and or arrest at their directive. Kind of how this looks like is all complaints, violations still need to be directed through the public health hotline. I believe it's 651-6415. Is that correct, sir? All complaints still need to be routed through the public health office. They will be monitored through the county attorney's office, and then they will enlist law enforcement's assistance as necessary to help enforce those violations that were reported. Additionally, on top of that, we have directed all of our officers with the Billings Police Department that they are not to drive by or ignore blatant or egregious violations if they observe them while on their routine duties for patrol. And we ask that they make consensual, safe contact with those in violation and educate them about why we're taking these measures, potentially providing them a copy of both orders, and then leaving it at that. And that's going to be our primary first goal is education and compliance with this order. Again, if we do have repeated violations or blatant egregious, we will create a report. We will send that over to the county attorney's office, and then we will communicate with them on any violations and or citations that'll be issued underneath of that. On top of all of these complaints and the violations, the police department is still actively doing business as it was before this event. We're still responding to day-to-day calls. We're still enforcing traffic laws and those types of things. Okay. Some of the things I know people might have some questions for is what this doesn't look like and some concerns. No, we will not be setting up checkpoints. No, we aren't going to be driving around and just stopping people who are driving from point A to point B on the roadway. One, there's no authority for that, and two, that's not the intent of what we're trying to achieve for our community here. However, we will still be enforcing criminal laws, traffic laws. So if you see our officers out there pulling people over and talking to them, it's in the routine order of business, and law enforcement is business as usual as far as responding to calls and being there to serve the community. The main difference is we have adjusted some of the ways we respond to calls for service to help with the social distancing and to protect our officers and the rest of the community. So I hope that clarifies of what law enforcement's role looks like We stand by to assist the county attorney and the public health officers at their request, and we will still be out there doing our job to help protect and serve the community. Thank you.
Thank you. I really appreciate the work of our law enforcement colleagues, County Attorney Twito, Sheriff Linder, Chief St. John, and Lieutenant Woolley and their team. I just want to echo that nobody wants to see people get arrested and go to jail. What we want is for people to voluntarily comply with these orders, and there's a really good reason for that. The governor's order requires that gatherings be both essential and limited in size. The governor's order is not an either or, it's a both and. And I think that's been some confusion. So we've had some folks say, you know, it's a small group, isn't okay. It's got to be essential and it's got to be limited in size. There's a reason why we stand before you today and talk about really serious things that, quite frankly, nobody wants to talk about. As Mr. Twito said, I didn't want to issue these orders. I would bet money the governor didn't want to issue these orders. But here's what we have to understand. The cost of failure to follow these guidelines is catastrophic. This isn't just a, oops, we didn't do it. This is catastrophic. It's the cost of failure is almost unimaginable. Yesterday, the Associated Press reported that the White House projected between 100,000 and 240,000 deaths from this coronavirus pandemic, even if, keep that in mind, even if current social distancing guidelines are continued. Think about this. The midpoint of that range between 100,000 and 240,000 is 170,000, the equivalent of the death of every man, woman, and child in Yellowstone County over the course of a few months. That's why we stand before you today to say this is serious. And this is also important to know. We are weeks away from the worst of this pandemic in our community. A University of Washington model predicts the death toll in the United States will peak on April 16th, with a projection being that on April 16th, over 2,600 Americans will die that day of coronavirus infection. In Montana, we expect a later peak. We're a little behind the curve as most rural states are. Our peak is currently projected on April 25th. Right now we have 5 Montanans who have died of COVID-19. The projection is on April 25th, 9 people will die in Montana on that day. And again, these unimaginable measures, these numbers, assume that we continue the current measures that are in place, the governor's order and my health officer order and others around the state. And it assumes that we as the population of the state and nation adhere to those orders. Failure to follow these recommendations for a substantial period of time likely means more sick people, increased demands on our already overstressed healthcare and social service systems, and ultimately more families burying their loved ones. This is not an easy time for any of us, and the actions we take in the past few weeks and today will determine how quickly we're able to return to a sense of normalcy. I urge everyone to refer to Governor Bullock's March 26 executive directive for a list of essential businesses, as well as my amended March 20th health officer order for further clarification of who's covered. The current orders are in place through April 10th, and both are subject to change because this is an extremely dynamic situation. In the meantime, I urge everyone to stay home, only leaving for essential activities and necessities. Wash your hands thoroughly and often. Avoid touching your face. Avoid handshakes and hugs. Cover your cough and sneeze. And frequently clean high-touch surfaces with a disinfectant. I wish things were different. There's really no other way to help the community stay healthy and our healthcare system to be able to care for those who become ill than to slow the progress of this disease. I've said many times that this will end and we will all see brighter days ahead. if we all follow the governor's orders and my health officer order and the guidelines that you've heard over and over so many times, we will all do our part to make sure that there are many more of us here when those brighter days arrive. With that, we'll open for questions from the media. We'd ask that when media members have questions, please let us know who those questions are directed to.
I have a real brief one for you right off the bat. Where did you say, maybe you mentioned it, I missed it, where those projections for Montana's peak are coming from?
There's a website that was developed by the University of Washington. I actually can't give you the web address right off, but it shows projections for every state in the United States as a whole as to when we would anticipate peak.
Mr. Felton, on Monday, the governor said that the state was a day away from not having any tests available. Do we have tests available in Yellowstone County for our hospitals?
Yeah, we have the testing kits are available right now in terms of the collection devices. I'm not sure at the public health lab what their current capacity or number of tests they can run are, but we do have testing supplies here in Yellowstone County.
This is Greg Lamont. John, is there a model, we've seen these national models, is there a model for Montana?
Yes, Greg. The one that we have been looking at is developed through the University of Washington, and it does go state by state, and it shows information related to projected. It defines the peak as the day of the number of highest deaths, and then also has some information in there about projections for availability of other resources. I don't have that link with me right now, but it's pretty easy to find online.
Did you say it was the 25th?
Yeah, the current projected peak date in Montana is April 25. Yes.
Also, I think that you would agree that most people deal with this kind of strain better when they feel like they're being given the facts. And I'm looking at things like Wimbledon announcing that they're canceling this year. Well, that's not something until late August. So I'm thinking from a realistic standpoint. Now, this thing has been extended till April 10th. Shouldn't we expect this to go through the summer?
I don't think we know how long it's going to go. Each one of these countries have different approaches to their methods of containment and mitigation. I think if we believe the current modeling, then certainly we should expect to have some degree of restriction in place well beyond April 10th. What really is going to determine how we do, though, is what does the backside of that curve look like? Yogi Berra once said that predictions are difficult, especially about the future. Bear in mind, this is a novel virus. This is a pandemic that we haven't seen since the 1918 Spanish flu. And so there's a lot of mathematical models, but all those mathematical models are built on a set of assumptions as to the rate of spread, the rate of recovery, how long it takes. So we use those models to the best of our ability, but you really can't say exactly what this is going to look like in 2 weeks or a month or 2 months.
Well, wouldn't you agree that most health professionals would probably advise to continue the distancing until there's a vaccine?
I think the social distancing is always going to be a good idea. The vaccine, we don't know what the time is. What we really need to watch is what the spread looks like. Typically, in an epidemic situation, there is that first biggest peak, and then it'll start to come down, and then you'll have a few more waves. One of the things that we've talked about in our community and across the state is when these orders end, and they will at some point, but we will not go back to business as usual. What we'll go to is a continued need for some social distancing, some limitations on large groups, because the virus will still be around. Okay, so I don't think you're going to see us go straight from the end of the orders to business as usual. This is going to take some time to sort of work its way through.
When it comes to distancing, we're told 6 feet, but then at the same time we're told that coughs and sneezes can travel 6 feet. So I'm wondering, why do I want to be in the landing zone?
So I think what you hear is that 6 feet is the minimum. There is nothing wrong with being farther away, and I would encourage that. I think the other thing that we have to keep in mind is we are social beings, and as we distance ourselves, that causes a huge amount of stress on people. We need to find ways to stay in touch. We've got opportunities to stay in touch that we've never had before. Things like social media. Pretty much everyone's got a cell phone. I can tell you that I live less than a mile from my grandchildren, and I see them on FaceTime. So at this point, farther away is definitely better.
Well, I'm also wondering, there was discussion this morning, and this was with Dr. Fauci, and he was talking about asymptomatic people who aren't going to show any symptoms. And he was asked, well then, if they're not sneezing and coughing, how are they transmitting? And he said, well, most likely through conversation. Would you agree conversation can infect you?
Well, certainly when people talk, they express droplets. That's why the 6 feet distant isn't just for when you're around a sick person. We need to be separated because that those droplets do get expressed when people talk or sneeze or cough. So I think we don't know enough about this virus, and I think it's important to remember we are on the 1st of April, and this virus was identified in early December. So we are 4 months into understanding this virus. As hard as it is, we are far better served by being more conservative in terms of our responses than by being less conservative. If we're going to be criticized as individuals in society, let's be criticized for being too safe and taking too many precautions than not being safe enough.
Lastly, restaurants are allowed to remain open for drive-through and delivery. I was at a drive-through yesterday, and I noticed the guy was wearing gloves, and I was very careful with my change and that kind of thing. But he wasn't wearing a mask, and I'm wondering, do you think that it would be prudent for food workers to be wearing masks?
So historically what we've believed about most respiratory viruses that get spread like this is that masking well people does not produce any substantive benefit. What's being talked about now with CDC and what I think Dr. Fauci is getting at is, with evidence of asymptomatic spread, the question is, at what point does it make sense to mask well people? That is something that experts in the viral biology and transmission are looking at right now, and I think that's kind of where Dr. Fauci was getting.
Well, as you know, they're talking now about maybe everybody ought to wear a mask.
Right, that's the idea of if there's asymptomatic spread, it doesn't make sense. I think the other thing we have to bear in mind is we are facing a very significant limitation on personal protective equipment. So I think I've said this many times in front of the media and in front of a lot of people, and I think this is important for the public to understand. We are not in a situation where we get to choose between a bad option and a good option. We're in situations where we need to choose the best of the suboptimal options, and I think that's definitely a place where that PPE question comes into play. Is it better if we mask everybody? Arguably, yes. If that means that we don't have personal protective equipment for first responders and healthcare workers, is that a price too high? And everyone is still trying to work through those.
Would you be in favor of shutting down the country for, say, a month?
I certainly do not pretend to be able to make federal decisions, so I wouldn't comment on that.
John,
Okay, go ahead.
have we had any hospitalizations so far in Yellowstone County due to COVID-19?
Yes, that was reported, I think, end of last week or over the weekend.
Is it one person or?
I believe we're still at one. I know that there's a lot of interest among people to get a lot of detail about folks. We are not going to provide that for legal reasons as well as ethical and moral reasons that people have their rights to privacy. So you'll get the very limited information that we've been able to release is all we can give out.
So at this point, one confirmed.
I believe that's our current status, yes.
Oh.
I've been a little hesitant with numbers because pretty much they change so rapidly that if I tell you something now and you go look up something in a little while and it would be different. And so, any other media questions?
Yes, this is Nicolette
Oh.
from Yellowstone Public Radio. Thanks everybody for holding that. I'm curious if law enforcement and public health officials, as you guys have been moving through the community, do you get the sense that the public is taking this as seriously as you're trying to communicate it?
I'll hand that to Lieutenant Woolley first.
Yeah, so that's a really good question. The overall feel when we talk to our officers and us being out there is that, yes, people are moving about their essential activities, but we're not seeing any increase in calls related to this. We can't see any patterns of changes of calls for service. And that kind of indicates to us that most everybody's doing what they should be doing, and we're not having negative impacts from it. And if anything, we're seeing some positive effects from what's going on of people helping and coming together in the community with each other. And the overall feel that we have from our officers is that everybody's doing what they need to do. Everybody's staying calm, and we're not having those types of social issues that one might think of or be fearful of.
What I would add to that is I agree. I think most people are trying. I think there has been a little bit of confusion about if an activity is essential, can you be in a large group? If you're in a small group, can you do non-essential? And again, it's a both and. The governor's order requires that only essential activities be performed and that those essential activities be performed in small groups. So I think that little piece of confusion hopefully will get clarified. But I think generally folks do take this seriously and are trying. And we see a lot of people out walking these days. Any other media questions? Oh.
If I could follow up, I know that Yellowstone County is reporting, a number of confirmed cases in the county, but with community spread happening and, limitations on testing, I'm wondering if you have a ballpark estimate of how many suspected cases there might be, and whether you are tracking the number of people who have been told to self-isolate or self-quarantine because I believe they have the virus even if they haven't been tested.
Yeah, so there's no way to know what the potential number of cases could be because a lot of people have very mild symptoms and they would never report that. Ultimately, you'll be able to sort of mathematically figure out what the likely infection rate was, but that doesn't exist yet. We do, when a case is deemed positive or people are at certain risk scenarios, we do make recommendations for or requirements for quarantine or isolation. I don't actually have a number of how many people have been affected by that. Many people choose to self-quarantine, and we certainly wouldn't know about those as well.
Thank you.
Okay. Any other questions from the media?
Lieutenant Woolley, we're hearing from Billings County that they're seeing an uptick in domestic violence cases. Are you seeing any of that in Billings?
So, Greg, in fact, we looked at some of the domestic violence numbers over March, and one, it's too early for us to tell. Looking at the numbers day by day, there's no consistency or pattern to what we normally experience from any other given month or comparison to last year's. And so we don't have enough data, nor have we heard officers who have the general feeling that anything like that is occurring. And it's going to take us a little more time. I think we need a bigger data set to be able to say or draw any conclusions to any correlation to this at all.
Got it.
All right. Any other questions from the media?
I I've got one more question about testing, and again, I'm guessing you might not know this, but I know some of the hospitals are sending their test kits to private laboratories. Is there any, are you able to track those in addition to what's getting sent to the state lab for analysis?
So what we get from, particularly from the private labs, public health gets notified of all positives. We don't get notified of all negatives. So somewhere those numbers exist because there's records of the orders, but we do not have immediate access to those numbers. I'm not sure how many have been sent out total.
Thank you.
I've got one more that I think there's been a lot of confusion.
Woolley.
Could you hold on 1 second, please, on the phone? We got one more question here first. Go ahead.
There's been a lot of confusion with the Valentine water situation, people in the public maybe not understanding about the safety of Billings water. Could you maybe clarify that?
Yeah, there's no relationship between the coronavirus that causes COVID-19 and the water supply. So it's not an issue. Okay.
It was about because of the Valentine water order, and then people are confusing that, I think, with the
Right.
water order, and I've been seeing some questions.
Oh, okay. So
Please clarify that.
So the issue in Ballantyne is related to contamination of the water supply that is not related to the coronavirus. The water system in Billings is doing the work they've always done to make sure we have a safe and clean water supply, and it is fine. Okay. The question for Lieutenant Woolley on the phone?
Yeah, sorry, Matt, to get that. You referred to blatant and egregious kind of violations of requirements in place here. What would be a couple examples of that?
You know, so there was some initial, before this order came out, there was some Facebook postings about some groups that were just going to go ahead and have large group meetings in violation of the order because they didn't believe in it. We were monitoring that as well. But anything, if we drive by a park and you see a group of 20 or 30 people who are not practicing that social distance, that would be a blatant violation. Egregious violations would be repeat offenses of such violations, whether it be a business or a private citizen not following the rules of the orders. And I think you can enumerate exponentially based off of those orders of what those scenarios could be.
Thank you.
Any last questions? All right. Thank you very much to our media friends for being here and also for helping our citizens understand what these orders require. Thank you.
Thank you so much
Greg,
for holding
Lamont.
Yeah.
Sean, do you have a couple of minutes just to talk about some of that pass-through?
Yeah.
Kind of in a 6-foot circle. There's a request for somebody to go